You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone.
All right. Good morning, Dr. Lafferty. I really appreciate you taking time to come and join us on Dr. Osborne's Zone. If you would, let the audience know a little bit about your background, your training, your expertise.
Okay. Well, first of all, currently I'm an endowed professor at Nova Southeastern University, and I taught 7 years in the medical school. I still teach medical students and doctors and residents. I put courses together in functional nutrition for our master's program. And now I'm in the pharmacy school putting nutrition programs there. And also I have a clinic where we do deprescribing, and that's something new even in the pharmacy world, because we realize that a lot of times people are getting sick from being just put on one drug after another, and it's training that the physician doesn't have. They're not trained only how to put people on drugs, not take them off.
So in essence, deprescribing, we have an epidemic of polypharmacy in the US for sure. You're helping people get off and restore health without the need for multiple medications. Is that fair assessment to say?
Well, right. And also for me, because I also am a master herbalist and a naturopathic doctor. So I have a doctorate in pharmacy, and I'm also a naturopathic doctor and a diplomate from the Board of Clinical Nutrition. I will replace supplements. And I think that when we say the word supplements, a lot of patients are just kind of thinking about the vitamins they get off of a grocery store shelf. And a lot of the supplements that I use actually used to be prescription drugs. And so those are the supplements, and those usually are supplements that you get from a chiropractor or a pharmacist or a medical doctor. You can't buy those usually on the drugstore shelf. Some of them could be a little bit dangerous in the hands of people not knowing exactly what they're doing with them too.
So you're using, in essence, nutraceuticals to help people kind of transition away from medicine and re-empower themselves back to good health without being enslaved to drugs for the rest of their life.
And 99% of what I use are herbal remedies. So those come from plants, animals, bees, or the sea. So that's, and then I do use a few what we call orthomolecular products that are made a little bit more like drugs are made. And vitamins really are made like the ones you buy off the drugstore shelf. They're really made like drugs, or the exact same thing. And that's because of the history of what happened to the natural products and things like that, homeopathy.
Yeah. Well, we were having a conversation here a few weeks ago at the American Clinical Board of Nutrition annual meeting, and I was a little bit jaw-dropped by some of the things that you were saying about how medical education in medical schools is going. And I'd love for you to kind of highlight what you've seen, both as a professor and practitioner of the arts. What are you seeing in the medical schools? How is the education transitioning away from what it used to be?
Yeah. So, first of all, I guess I've been there for over 12 years, so I didn't probably recognize it at first. And, but one day, one of my best friends who was the head of executive medicine for University of Miami, and she's actually in the book 100 Best Doctors in America. And I brought her to a conference more on holistic and bioidentical hormones and that type of thing. And one of the things that was shocking to her, and I'll tell this story, he wrote the book, Are Your Hormones Killing You? Dr. Eldred Taylor was our keynote speaker. And he, first of all, put the bioidentical hormones, the pictures of those up next to your hormones, because they're called bioidentical because they're identical. And saying that this other really big molecule, which is called progestin, or which is in like Prempro or Depo-Provera, is got a big molecule on it, and it's nothing like your progesterone. And a matter of fact, when they did the biggest study ever called the Women's Health Initiative for Women's Health, the drug company partnered with our government, and that had to be stopped early from those prescription hormones because there was more cancer in the people that were taking them. So anyway, he said that his first day as a resident at Grady Hospital, he had a woman with irregular bleeding, and he asked the chief resident, told him, I have a woman with irregular bleeding. And the chief resident said, how old is she? She's 22. Oh, give her birth control pill. Okay. Then he had a similar case, and she was 42 come in and said that she was 42. And he said, oh, does she have a uterus? Yeah, she has her uterus still. Okay, give her Prempro. And then another woman at 52 comes in and she has no uterus. Oh, give her just Premarin. And he said, well, why did I give one Premarin and the other one's got progestin, which is the fake progesterone. But anyway, he said, oh, if you don't have a uterus, you don't need progesterone. Well, first of all, progesterone's the master hormone that makes all the rest of the hormones. So you do need progesterone. It's one of the reasons, by the way, that people get cramps, women get cramps during their period, is from lack of progesterone. And a lot of times those women grow up in very stressful households as children, because the progesterone, if you're under fight or flight or stress, progesterone goes straight into cortisol, and progesterone makes the lining nice of your uterus. And then when you get your period, you shed your lining. But if you've been under a lot of stress, because I've worked also with drug addicts as well, women drug addicts who had a lot of stress as children, and all of them have very, very rough menstrual cycles. So, and there's things that you can do for that to rebuild that up. But anyway, just sorry to go off.
Right. Good. So we've got synthetic progesterones and estrogens being prescribed. We've got a sidebar into too much stress takes progesterone down the pathway.
Right. And for your listeners, if you have cramps, one of can I just say a miracle remedy, I wish I'd had it as a kid, is black currant seed, 2 capsules at bedtime. And usually that'll ameliorate that in 2 months. And you can take it about 8 times a day to 4 times a day. I mean, if you have your period. So just a little sidebar remedy there for them. Anyway, let's go back to Dr. Elred Taylor. So he said, and then he showed, and there were about 12 gynecologists, what do we give for all these women problems? Amenorrhea, dysmenorrhea. So, we give 3 drugs. That's all we give. And he said, he said, after 7 years of that, I was ready to commit suicide. What am I doing? And then he said, for those who don't want to learn about natural things and bioidentical hormones, I'm going to at least teach you to have more time, because all you really need to do is get a headset to the front desk and ask room A, how old are they and do they have a uterus? And then grab the sample and have your prescriptions pre-written. And then he said, before you leave, by the way, have your antidepressants in your pocket, because if what you're giving doesn't help, the women are crazy and they give them the antidepressant. And then when that doesn't work, you get to do the big ticket item, because that uterus will never work. Just, you rip it out. So with that, and so my friend turned to me and she goes, oh my gosh, that's why I always send you my GI patients. I can prescribe Nexium or Prilosec and order a scan, and that's all they do at our GI department. There's nothing else for the people. So she asked me to go and do a physiology lecture on the GI tract for her group. And she said, do it the way he did. Go get the big textbook, the Guyton that we learned, which, by the way, I have it right here. It's like
right behind me.
1,400 pages right here, Guyton Medical Physiology. So I go to the book behind you. Yeah. And he goes, go there. And the lady was I went to University of Miami bookstore, and she didn't speak great English. So I'm going, Biblioteca muy grande, because she's giving me these little tiny book that looked like a Reader's Digest. And she said, oh, I'm going to give you the main librarian that runs the bookstore. And she goes, that is the physiology book. I'm like, what? She goes, yeah, that's the one on cardiology. It was probably it was like Reader's Digest, and it was about half as big. It was just this tiny. She said, they've broken the body into pieces. And I said, but they'll never learn that most heart disease, because she said that one was for the heart. I said, they'll never learn that most of it comes from stress in your adrenal, and it has nothing to do with your heart whatsoever. And she said, and she burst out laughing. They go, they don't learn anything anymore. So my friends.
Wait, let me stop you there for just a second. So if we back up, you're in the medical bookstore.
Right.
For medical
students. It's been like 12 years ago.
Yeah. And they're giving out texts instead of texts, like the Guyton textbook, which is the kind of the hallmark classic for the last, several decades of education. They're giving out pamphlet, Reader Digest, mini versions for doctors to learn it.
Right.
Okay. I just wanted to make sure I heard that right.
Yeah. And they don't take biochemistry anymore, and their pharmacology. So going back to some of the natural things, I don't have it with me, but I have a PDR. It was a physician desk reference from 1979. And I got out of school in 1981. I never worried about giving something to somebody and then, getting sick from the medicine, except for chemo. We knew chemo would make people sick back then. But other than, and I didn't give chemo out because I wasn't that type of pharmacist. But the thing was, we never, even though they say digitalis is poison, it's from a plant. It is poisonous, but it's really a homeopathic dose. It's such a tiny dose when they use those poisons like that you'd really have to take probably a bottle full to really get ill from it. But anyway, we never ever worried about that whatsoever. And I had one of my students go through and put a little Post-it note with every prescription digestive enzyme. There's probably 20 of them back in 1979. And I think there's 12 pharmaceutical companies that made those. And why? Well, there was about 50 studies that show as you age, you lose your digestive enzymes, capability of making digestive enzymes. So when you take a digestive enzyme, it will help digest your food. And so you're not Prilosec deficient, you're deficient in digestive enzymes. Cholesterol, when I got out of school, was 270. We didn't worry about that very much, and didn't even really learn that much about it until the drugs that are very expensive came around. But when we did treat it, we treated it with bile salts, and I still use bile salts if people need to lower their cholesterol. And it still works, just like it did 40 years ago. It still works. The other thing that with the bile salts, it was standard of care for people to get bile salts when they had their gallbladder removed. And if there's anybody out there that has removed their gallbladder, if you take bile salts with your meals, it's going to be a game changer for your life. And interesting, in my naturopathic course, I learned that it helps make a taurine that facilitates dopamine. And so I thought to myself, I wonder if that causes Parkinson, because that's a disease of low dopamine. And we have a big group, about 100 patients of Parkinson that our psychology department has. And every year they ask me to speak to them once a year. And so I said, I can't really ask you because of HIPAA, but I really wonder how many people who had lost their gallbladder got Parkinson. Well, I had about 6 men come up after the talk and say, I didn't get one Parkinson's symptom until I lost my gallbladder. So when I hear things like that, so we took all these wonderful courses. And then our last year at Medical College of Georgia, we were with patients in the hospital with the medical students and the doctors. That's what we did for a year. And I remember we had a case of pancreatic cancer back then, and they're like, oh my God, we've never seen this before. And they said, okay, every medical student and me go to the medical library. And back then you actually had to go. We didn't have computers. You had to go to the little card catalog, find the journal, because maybe we missed something. Maybe there's a new treatment that we don't know about that we can help this patient with. That's what I did when COVID hit. I remembered my grandmother telling me, my grandmother had a 150-acre farm and never took a drug. And I remember her telling me that we were by her elderberry trees, and she said that she had treated 20 people with this really bad flu. She was talking about the Spanish flu. And she was in Western New York, southern Western New York, near the Finger Lakes. And she said none of them died. And then our family took it as a preventative, and we didn't, nobody got sick on our family. Now, my great-grandmother, who had just come from Italy a few years before, who lived in Buffalo, only like 40 or 50 miles away from my grandmother, my other grandmother, she died of the Spanish flu, and it really was devastating for that side of the family. My grandfather actually had to go into a Catholic boys' home. God bless his soul for that. These diseases really cause devastating effects. But I learned from my grandmother on the farm really what healthy was, because she was incredibly healthy. And she did everything we're supposed to do. She drank well water. They would hunt. She would can deer meat for the winter. So had wild turkeys. She killed her own chickens, and she really had an organic lifestyle. My grandmother didn't even have electricity, and my father was the head electrical engineer for Motorola. And I remember as a little girl, he was so excited. He'd gotten a team of people together and said to my grandmother, next weekend, we're going to come put electricity in. And she goes, absolutely not. That disturbs the electrical current in my body. I don't want it. And, I was on for several years the board of the American Academy of Environmental Medicine, and we see patients if their electrical boxes are near their beds, or even people have to actually move to West Virginia because Wi-Fi can cause. We saw a case of someone that looked like they had Parkinson or MS, and it was all 100% due to the Wi-Fi. Her shaking and everything totally stopped when they put her in a room where there was no Wi-Fi. So my grandmother knew all that back. She was born in 1900, so a long time ago.
Yeah, a lot of change in the last 100 years, just radical chemical exposures, electrical exposures, EMFs. So let's go back to, you were saying, your understanding of what they were learning in medical school was being basically condensed into like a Reader's Digest version. Do you have other exampos of that? I mean, that was 12 years ago. What are you seeing today?
So there's no I always say, sometimes I talk at conferences, this book, our medical physiology, which was my favorite, it made me very good at what I do today, because when I walked in pharmacy school, they said, and we had 3.5 averages in calculus and physics. So, a third of you'll flunk out. look to the left, look to the right. A third of you will be flunked out. And we're like, well, excuse me, we had to have a 3.5 in calculus and physics and biochemistry to get in here. And sure enough, a third flunked out. And it was from my medical physiology professor, who would ask a question like, if you have Addison, which means low adrenal output, your adrenals are weak, what happens to the QRS wave in the heart? So she connected the whole body together, and every question was like that, where you learn that the body is so logical and it has such common sense. And it's what they're teaching is so non-common sense and ridiculous. So I don't think they want them to learn the real science of what's going on. And what they'll say is, oh, they took physiology undergrad. That's what they'll say. But they didn't have Becky Bunce asking very, very difficult questions. So you really understood the hierarchy and how that body worked. So we had a pharmacology book that was thicker than the Guyton book called Goodman and Gilman. And in that book, they had things like poisons and something called chelation when you get too many heavy metals. 200 pages of that book, and little tiny writing in these books too. They're big, but they're tiny, tiny writing. And they talk about different types of metabolites of the vitamins and all sorts of things in that book. And today's medical students, they get none of it. That took a year, that course. Now they get 6 weeks. And it's basically, if somebody has a strep throat, first give them amoxicillin with clavonate, and second, give them Z-Pak. If that doesn't work, send them to a different specialist and get them off your hands, because that's what happens. You go from they learn nothing, and you go to place, and they keep testing because they got to do something, and that they don't resolve many things. And the problem is, a lot of people in public, that if I am at a conference or my patient, they'll start blaming the doctors. Well, those medical students come to me and say, Dr. Lafferty, I just spent $1 million and 22 years of studying day and night of my life, and I don't know anything. Or I worked with the psychiatric residents once, that they're already physicians, and then they go do residency in the psychiatric hospital connected to another hospital. And I was doing a mindfulness. So I started off by asking them, what do you think about when you come in here? How do you feel? And the first one says, I think I'm going to kill somebody with these drugs. And the next one, I think I'm going to kill somebody with these drugs. So imagine you spent all this time, and their hearts, there's a few of them went in it for the money and the prestige, of course, they're big egos, but most of them, you don't work that hard and not have a passion inside of yourself to help people. They want to help people. They just don't know how. And a lot of times when you go into the doctor's office, they'll be very mean because, oh, okay, you took this digestive enzyme and all your problems are all right. Well, I've got nothing for you. Get out of here. Or I had her father was a doctor at Harvard, and she's a brilliant lawyer from, I think, an Ivy League school, and spoke perfect Chinese. And I tell you that because she lived in China for 12 or 15 years, putting all the contracts together for McDonald's when they were putting their McDonald's across China in the early 2000s. And she's had lesions all over her arms. Her period wouldn't stop for 5 years, and she could hardly defecate or poop, like once every 2 weeks, even with all these meds they had her on. And she went to Harvard told her, if you don't take these drugs, we can't do anything for you. And all they want to do is shut down your immune system. But there's a reason why the immune system is working. And then she went to an infectious disease doctor down here after going to about 20 dermatologists, and they kept trying to biopsy the lesions. And well, there's nothing in those lesions. The first thing I ask her, because when I see patients like that, the first thing I ask, and they always say yes, do you travel a lot to the third world? One of our employees, he was the pianist for the UN, and he would travel to 125 countries a year. So he was so he had these types of lesions on him as well. And she said, you're the first person after like 10 years of trying to find help. And anyway, when she went to the infectious disease doctor, he said, you know what? You need to go see a psychiatrist. And she's like, you're telling me that these lesions, and I've had my period for 5 years straight. This is all in my head. And yeah, it's all in your head. Well, it took the pharmacy students going on Google, looking at those lesions to figure out she had schistosomiasis, which is endemic in China. So no one ever asked her, did she live someplace else or visit a lot? Like, there's no curiosity at all. It's just dismiss. And this ego attitude of, well, if I don't know it, how's a chiropractor or a pharmacist going to know those things, or, whatever. So you have this unreasonable ego with a lot of the doctors. And I think they're just trying to protect themselves from experience every day having no information.
Well, it seems to me like they're graduating technicians.
Yeah.
I mean, anybody can learn a recipe and follow a recipe, but it takes a special kind of person to think. But if you're not being taught to think, and you're being taught to not, actually the opposite, you're being taught not to think. You're being taught to structure the body into subsections, right? And that the body is actually a sum of its parts, and not this intricate web of wonderful interconnectedness. You're going to end up with doctors who don't really have any ability to help anyone, and their only choice is to draw, from the pharmaceutical toolbox of potential chemical manipulations. Do you think this is stemmed from the influence of pharmacy in medical schools? What's happening? I know we can't say for sure, but like, what do you think is going on? Are pharmacy companies influencing so greatly medical school curriculum? Is it just a watering down of the curriculum for some other reason? Like, what do we think is happening?
To tell you the truth, my summation from what I see that's in the curriculum is really how to use drugs. I mean, that's it. When I went to pharmacy school, we learned homeopathy. We learned, like if somebody has an asthma attack and they don't have their drugs, give them coffee, and that the structure of caffeine and theobromine from chocolate is very similar to an older drug called theophylline that we used to use. And that was the other thing, which makes me a very good herbalist, because we used to have tests in our medicinal chemistry that they would give you just structures and say, hey, tell us how this works, so you had to know what that structure looked like. So when I see these structures in the plants, and my students love that. It used to be called pharmacognosy, but they took that pretty much out of school. But we do have pharmacognosy as an elective at our school, and we also have nutrition as an elective. And the pharmacists really used to do a lot of nutrition. They used to do the TPNs, which is the type of nutrition you could really die from, because it goes in IV, and if you give somebody too much potassium or something, you can stop their heart. So we really had to learn a lot of nutrition, and again, that was in our pharmacology textbook back then. The other thing which really upset my friend, like I said, who's in the book 100 Best Doctors, her son is in medical school, and they took anatomy out of his curriculum. Like, why would the doctor need to know the difference between a muscle and a ligament, right? And also that they're having the second year students teach all how to do vital signs and stuff. And she's like, I'm paying $60,000 a year for them to get second year students to teach this. it's very sad. And I'm sure a lot of your audience has had a lot of the experience, because when I speak to big audiences, I spoke to 700 people and asked them how many of them have a doctor say, I don't know, or go to this specialist and that specialist, and you never get resolution. And at least a half to three quarters raised their hand that they'd had that experience before. And it's sad for the doctors. The medical doctors right now, they have the highest rate of suicide. So, it's difficult on them. Imagine you're only given okay, they're all proton pump inhibitors, right? Nexium and Prilosec. So what they do, Dr. Prilosec didn't work. Well, you know what? We'll try Nexium, or we'll try another one. And oh, this doesn't work. It's worse. So how much can you listen to that every day? And then they have something what you said is a lot of people have this impression, and this used to be true about 20 years ago or 25 years ago. I actually worked for a big pharmaceutical company for about 3 years, and they gave you a huge budget to take, you got reprimanded if you didn't use that budget to take doctors out for dinners and really expensive dinners and things like that. But they don't have any of that anymore. They must have bought off the people that make the curriculum in the schools, because put someone that believes in their influence in.
What do you think is the long-term solution? I mean, if the way of the medical system is going, the way of commercial influence, how can we ever get good, solid care, especially when we've socialized care in the last several years, and now it's like, okay, tax dollars are being subsidized to pay for care that frankly sucks, to pay for doctors who are technicians and can't think. And so you bounce from expert to expert to expert with no viable solutions. Polypharmacy kills a third of the people in the country. What's the out here? The person watching this, maybe it seems a little hopeless if you're on the other end and think, okay, I'm on a budget, I have Medicare, functional medicine and functional nutrition is not inexpensive, for most. How do I get viable care, in today's world?
Well, I have a course. It's called Become Your Own Health Investigator. And in that course, I have recipe books for herbal remedies. I was so upset with, we don't have anything for COVID. Well, I'm going through the literature and finding all these different things that kill COVID, from eucalyptus. Of course, I told you about elderberry, licorice, and alcohol. But it has to be a certain type of licorice. There's a lot of licorice that may not be as antiviral. Get yourself a tree of olives. Even I grow it here, even though I'm in South Florida and it rains like crazy. I'm never going to get an olive off from that tree, and I have to keep it dry. I keep it under a thing so it gets a little moisture, but not too much, because it likes to grow in dry climate. But I think you could probably even grow it in your house. But those leaves are highly antiviral. I mean, they are like the number one, it looks like in the literature I've looked at, the number one to kill off Epstein-Barr virus, which a lot of problems are caused by that. And also flus is my number one thing go-to for children. So there's a lot of remedies you can make yourself, and just buying some trees or a small tree, using those leaves every day. It's a highly antioxidant. That's why they recommend the Mediterranean diet, that in Italy, they have like the lowest rate of heart attacks, because it's very powerful antioxidant. So it'll relieve damage to your heart vessels. And so just things like that you can do are very helpful. My grandmother never took a drug till she was 80. And that was only because she was in a very bad car accident and she broke her hip. And this was in 1980. So they didn't have the blood thinners and the hip replacements. And they said she had a 0.01% chance of making it through the surgery. But when she came out, they go, she's got bones like a 50-year-old. And she lived on her own with no electricity, mind you. And she had to carry wood because, and all these things in her 80s after a hip injury like that. So she lived another 13 years in her house by herself. And then they had to put her in a nursing home, and that kind of did her in because she didn't like the food and all that kind of stuff. But anyway, I've seen good health. And the other thing for me is I also do prayer treatments and meditations in my practice, And I haven't had one student, and I have students who are Hindu from India. I have students who are Muslim from Saudi Arabia or from Jordan. So I have students from all over the world, and none of them object to that. I haven't had anybody. Now I've had a couple patients. I don't think really wanted it, but for the most part, because in our Bible, God tells us over and over again, I will heal you. He doesn't say if you're a good girl this day or on a Tuesday, or he says, I will. And Jesus says many times in the Bible and other holy books, like I didn't ever realize until I had so many Muslim students and went to the Middle East that, they learn a lot about Jesus. And many of our stories are in the Quran as well. And most of them love the teachings of Jesus, So they understand that when Jesus teaches you something, that's something you can bank on. Like that, I grew up a Catholic, and I loved the Catholic Church to a point, but I started going to the Church of Religious Science, which is not Scientology whatsoever. It's just looking at those teachings like we would science, saying that we don't ever doubt that when we get up in the morning, gravity is there. Okay. Gravity is a scientific law. If we believed in those teachings like a scientific law, you will see miracles all the time in your life. So, and God many times will, because he knows that I like to look at the literature because I am a scientist, but I'll find that study right before a patient comes in. I'll just say, please, God, give me something. And I'll give you a great example of something. I had a patient that came in, and she had very bad nausea and vomiting during her pregnancy. And a lot of women lose the baby, and some of them even lose their own life because they can't hold anything down. And she did everything that they say in the medical field to put this Zofran pump on her, which is supposed to be anti-nausea, but she would still vomit 3 or 4 times a day, even with that. So we went to the society. It's called hyperemesis. And, my students talked to the nurses, and everything was being done medically that they knew of, right? But they did say that it was from a protein that a woman isn't exposed to usually, and this makes her vomit. So we kept looking for that hyperemesis syndrome. But what we found right at the last minute, I can't believe there's not anything in here. God, please help me. And I thought, let's look for the protein. Let's not look for the disease. Let's look for the protein. And that protein was in another disease, and it showed turmeric blocked it. Well, I happen to have some turmeric drops, and she was in my office because my first visit is about an hour and a half. And she goes, oh my gosh, I feel so much better. And I think she only vomited once, she told me, and she was able to take that pump away just by drinking some turmeric all day long and taking some calcium lactate to help her with the acid that would build up in her stomach. So, I turn to God a lot.
Well, I don't think there's anything wrong with that at all. I mean, we have to have I always like to look at what I learned as a chiropractor, or early on, was something, philosophy. I'm sure you're aware of the triangle of health, right? And so, You have the physical world, you have biochemistry or chemistry, and then you have the spiritual. And those three have to come together to convene together to help a person. And if you're ignoring one of those, you're missing a huge part of what might be an answer for somebody to get the help they need. And I think we've really lost sight of that in our society today because everything is focused only on the chemical arm of that triangle, and even synthetically so. So it's not even like, chemicals that we have that God created for us that can be used, that are here, that even naturally have tremendous power to help patients, but it's artificial chemical manipulation, and many times with the goal to silence the body's warning symptoms, right? So it's instead of saying, hey, how can we use this to work with somebody, we say, how do we block somebody's natural response to something that they're doing, even maybe in their own behaviors, their own diet or their own lifestyle, that is creating a problem, and we want to mask that so that we have a false sense of security as they move forward. And now their problem didn't go away. Their problem is just worsening in some other way, or that inflammation is just building underneath. And it's so frustrating. I know for patients, it's frustrating for a lot of doctors. I think, as you mentioned, many doctors spend a lot of money getting their education, and they have the empathy and they have the love and the desire to help people, but they just don't realize what they're getting into and then they get into their second or third or fourth year and they start realizing it, but now they're $1 million deep in debt, and they've got kids and a family. And what do? You can abandon everything you just learned at the cost of it all, but not a lot of people are going to do that. And so then we end up with a technician's mindset, universally in the US for our healthcare.
Yeah, I think, taking personal responsibility and, that voice inside of you, just trusting it and connecting with our higher power. I think that those two things, and, these drugs wouldn't even work if you didn't have something in the body that looked like them. So I also, I've worked a lot with drug addicts and things, and, dopamine, for instance, and norepinephrine. Those are neurotransmitters that come from our protein that we eat. And so I get a lot of either drug addicts or also mothers who come in and they don't want to give methamphetamine or an antidepressant for their kids who have problems with ADHD. And so and what's so funny, well, it's funny, not funny, is the package insert on the methamphetamine will say, oh, we have no idea how it works for ADHD. Well, if you go to the medical literature, you'll find that both dopamine and norepinephrine hit the attention center in the brain that gives you attention. And number one, and number two, they look just like methamphetamine. So actually, methamphetamine, when you go to the literature, increases dopamine and norepinephrine. So drug addicts, they get that dopamine hit and they really like that. And they probably don't make enough of their own dopamine. And then the norepinephrine, the same thing. So most of the time when the parents come in, and the same thing with the drug addicts is, oh, what'd you have for breakfast? And it's some, a muffin from McDonald's or a bowl of cereal with no milk. There's no protein and very bad carbs that really raise your blood sugar high quickly. And then same thing, type of thing for lunch. And then they don't even have the protein they need to make their own dopamine. And that's what I do. I change their diet. And studies show it when you give the B vitamins. So to be able to make conversions of these neurotransmitters, you have to have vitamins and minerals. That's where your vitamins and minerals come in, mostly B vitamins. And so when you give B vitamins to people that have a lot, that adolescents that have a lot of aggression, it goes down. Or you give the B vitamins, or you give zinc or iron, all of those things needed to make your own dopamine and norepinephrine to children with ADHD, their symptoms go down. So, we know that these things work by the medical literature. And that's the last thing they've taken out of medical school. They don't do journal club anymore. So they aren't even taught. I still have a elective up in the medical school, and they have to do 5 slides on a herb or something. And one used the chia website that sold chia seeds as their medical information. So they don't even know that that's not a same standard as medical information in the medical library are held to, So they don't even learn how to do a presentation or do their scientific references properly. That none of that is taught. It's really sad.
So they don't teach biochem. They've watered down physiology to Reader's Digest versions.
Well, they don't actually teach that physiology much. Yeah,
they've watered down physiology.
Right.
No more anatomy. No journaling. No learning about how to research, look up peer-reviewed research, and incorporate that into your knowledge base. Because to me, the whole premise of graduate school is not to learn fundamentals, is to learn how to learn. I mean, you have to know how to learn, because how much have you done postgraduate? Like, I know what I've done postgraduate, and I know, if you're anything at all like me, and I think you are, you've done thousands and thousands of hours postgraduate of your own research, because doctors graduate with a minimum criteria to get their degrees. But really, the career is where we learn far more than we ever learned in school, if we learned how to learn. So they don't do any of these things anymore. There's a tremendous influence of commercial influence in the school itself. And so what you're advocating really predominantly for is that people should take responsibility for their own health. They should educate themselves. They should be grounded in spirituality. They should learn older ways and potentially learn older remedies. You have some resources to help. We'll put that in the show notes for people to check out. And that ultimately don't outsource your health to a stranger who's been commercialized and doesn't take fundamental science and doesn't understand fundamental science, if you want to restore your health. Is that, I don't want to put words in your mouth, but that's...
No. And if you can find one, an older doctor, I write as the SAGE professor on Substack, and I've started this 25 things that need to be changed in medicine. And I'm on number 1 about Obamacare, because, there's so many things that did that people aren't even aware of. We hear 1 or 2 political arguments, but one of the things it did, it wiped out a whole bunch of very saged old professors that actually had this information. And then the second wipeout was Obamacare wiped out all the doctors who know you to come into the hospital. So there's only 3 ways that you can get into a hospital today, and that's by your insurance company hires a company that have hospitalists. They can admit you, or through the ER, or through a surgeon. So there isn't any other way. The doctor who might have known you for 35 years, he or she can't even go into the hospital and do anything for you, and here they know everything about you. And then the electronic medical record, my brother was in the hospital and his oxygen was 72. And the nurse's idea was, give him oxygen so we don't have to call a code, because they get dinged for that, because it's very expensive to go into ICU or whatever. And thankfully, there was a man who was the social worker, but he had been an MD, and he was probably 75 to 80. And he'd been an MD in Cuba. And Cuba, in the old days, used to have all these professors when Harvard was good, from Harvard. So they have really amazing medical school, they had wonderful. And so he went with me, but it would have taken us, if we had the paper chart, within 1 minute, I could have told you what was wrong, but we had to keep going through, going back, it took us probably 15 to 30 minutes to try to figure this out. And thankfully I had him, because anyone else would have said, oh, no, his labs are fine. But 30 days before, his iron was totally in the toilet. And I don't know why they weren't flagging, his platelets and all the other things that go along, red blood cells and all that go along with that. But the worst thing was he spoke Spanish, obviously, and I'm down in South Florida, so many people only speak Spanish, but his doctor, his hospitalist only spoke Spanish, I guess. And so the man that's a social worker is telling him that my brother has to have treatment. He's got iron deficient anemia. And the doctor must have asked him, what do I give? So he didn't even know how to treat anemia. And thankfully, he said 325 of iron with 500 of vitamin C, because you really need vitamin C with iron for it to go across the barrier into the body to be chelated. And I'm sure they probably don't teach that today, but I was really thankful that he was there.
Yeah, I have similar experiences where people come to me, they've been through the gambit, and their doctors say, oh, your blood's normal, don't worry about it. And I'm like, okay, give me the blood.
Yeah.
We get a request of the record, and it's like probably 30% of the time people are anemic. Either they have something as simple as an iron deficiency anemia, or they have a macrocytic anemia with, something as easy as B12 or folate being the driving force behind that. And it's like they're brain fogged, they're fatigued, they're short of breath, they can't exercise, they can't function. It's like that easy, solved, right? And anyway, I experienced the same thing. And it's like fundamental, basic, simple things are just, I have found it's alarming the rate at which I see people who have simple problems and not complex problems that just doctors don't understand anymore.
When I was a kid, my doctor graduated from medical school in 1897. He had Sigmund Freud as a professor. And he was in his 80s when he was treating me, but that man did everything. And you would beg for a shot because he'd give you adrenal shots and licorice tablets. And we're finding, as I'm looking, licorice tablets, of course, the right type of licorice, not the candy, but it actually kills a lot of viruses and H. pylori and other things. Mm-hmm. And adrenal is the corner. I always, when people are sick or long COVID, they call it, or where they can't get over, the adrenal gland and the endocrine system is really the cornerstone of the immune system. And that's in the literature. We have a Neuroimmune Institute, and there's a whole new way that they're looking at diseases. And basically, there isn't like an immune system or a endocrine system or a neurotransmitter nervous system. There's a system of these cytokines and neurotransmitters and your hormones, and they're constantly up and down regulating each other. And when you put an animal tissue like thymus, which increases your T killer cells or adrenals or whatever, it will have an effect on many different things, where a drug, usually it's just one thing. And that's why you get all the side effects, because those other things go out of balance and you get the side effects from those. But when you take something natural, plants have more genes than humans do. They're going to do so many things. And the way we've been looking under the microscope for the one thing that kills cancer or whatever, the one drug, the one note in the plant, that we now see that's wrong, because these systems are very complex within our body, and they really know how to take care of each other. And we have something in the plant world that doctors have a really hard time when I tell them, called adaptogens, where these plants and animal tissues, they're able to think on their own in your body, so that if your immune system is too strong, it'll actually dampen it a little bit. Or if it's not strong enough, the same drug will raise that immune system. So again, God tells us in the Bible that he's giving us these things to heal our body.
Yeah, absolutely. Absolutely. Adaptogens you look at what's happened to medicine just beyond the educational component. I mean, they've stripped away our historical archival understanding of a lot. And a lot of the really great doctors have retired because corporatization of hospital systems. And so, some of them are not retiring with all their knowledge. They're out there teaching, and that's fantastic. But, we have to have an archival collective, cherishing of this historical knowledge, because I think, there's millions and millions of lives that can be saved. And if we lose it, I think we're on the road to idiocracy of medicine. And that's, I think that's kind of where we're at anyway at this point. But I really do appreciate what you do, and I appreciate what you bring to the table for so many who are looking for help and seeking help. And just want to say thank you for being here and sharing your knowledge today. I'm going to put your information below so that people can learn more about you and find some of your programs and kind of get back to the basics.
If anybody would like to reach out to me, just hit the contact button at DRLYNNLAFFERTY.com. There's a lot of free training on there too, where I have the doctor I told you who's in the book, 100 Best Doctors in America. We did a free webinar that is about an hour and a half about all the drugs and why taking vitamin D and zinc and all those things. And those are very cheap ways to be able to prevent yourself from getting sick and getting in the hospital. I mean, that's got to be your goal. I'll buy I'll buy used clothes if I have to, but my food quality has to be about as good as I can get. And growing trees is really easy. That's what I mostly do on my property versus I do some plants, but and herbs, but growing trees, and there's a lot of healing properties of trees as well in their leaves and bark and things too. So Thank you again. It's really been a pleasure, Dr. Osborne, and thank you for all you're doing for your patients and public to get all this information out. I really appreciate it.
You're welcome. It was really nice talking with you, and I wish you the best until maybe next year when we maybe run into each other at the ACBN conference.
Okay, I look forward to it. Thanks.
All righty. Take care.
Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.